Yeah.
Do that too at a restaurant. What was that? Somewhere in here in Houston. I thought this was like in 2002.
Mm-hmm.
We eating and the gentleman was he throwing this and the jig was going down. He's grabbing his throat and he's doing this and one that. I just grabbed and went over there and moved the chair, grabbed him and squeezed me. And,
I was the dummy for that class.
and a piece of bone came out. He had a oxtail.
An oxtail. Oh
And he was
my
eating the oxtail and the fat on it was slit down in there and it got stuck. It wasn't moving, it was just stuck. And I jammed it. And that sucker came out. He was like, "Thank you." I said, "No, just thank God." I said, "Right
Yeah.
and he was choking and nobody knew what to do. And I'm like, "Get him."
And the work
That's
is
what
supposed
you
to be
grabbed
right.
it. They should be trained.
I just feel like to my kids when they start like get it out.
Mm-hmm.
Yeah. See, you don't know how much of an impact that is, and you're probably like, I'll be too afraid. I wouldn't know how to use this. Or but you
In
would.
the moment, it just comes to you.
It comes to you.
But the thing that they told me never lose your head. If you lose it, you're done.
Yeah.
My sister, my and my other sister, which had like CNA, so she couldn't react. Her son had to react. To stick the spoon down the throat of his brother. I was like, but you in school. You know, but
It's different when it's your
she
family.
said it was
Yes.
her sister, so she I was like, oh, because when my kids see that, I can't deal with it. I can't look at them.
Yeah.
And she told me that she was like, I couldn't, stick nothing down the throat. I was cute to cry.
It's that fight or flight that usually will kick in for you, and you'll know exactly what to do. I've had mine CPR since high school, so I've had it for a long
I was the
time.
dummy for that class.
Were you? Did you like being pushed?
I wasn't pregnant back then, so they had a dummy for the pregnant.
Oh.
To react, and I was like, oh, stop.
Okay.
I was like, leave me alone.
Oh, okay.
I don't want to do it because I heard you break something.
You know what? There is a security clause in the Good Samaritan clause for that. So it's called the Xiphoid Process, which is a gristle, bony part, the tail end of the rib in the middle.
Your sternum.
And the sternum, exactly. And if you happen to break it, it's okay. It's repairable. So, it's better to break it and that person be alive than you trying to be cautious and they don't come back.
Right.
They don't resuscitate. So,
That's why
don't
they
be
say you
afraid
gotta
of
put
that.
on the table like on the dinner.
Put someone right up here, and then you press with the palm of your hand.
Right.
Mhm.
I watch a lot of like forensic type of stuff with them. How they show the inside of body. Oh,
The only thing that I cannot tolerate is when someone breaks their bone.
Okay.
I had to help with the surgery for my daughter. She was playing with her cousin, and he hit her and he slashed like she got a stitches. I had to be holding her hand in her head. I was just like looking how it was stitched, and I was like, it's not
close
fun.
my eyes when they like, I'm not. She's like, no, you're not going to fit. I was like, yeah, I'm going to fit because I didn't know you fit right there. It's okay, so I'm looking.
And he
Well,
hurt me
you all
more.
in the right field,
But
because if you had to deal with blood, guts, and all that stuff, I don't know. I have no idea you all would make it, so good you chose the paperwork that administrates.
I think
Well, I was gonna go to the CNA, but the schedule didn't work.
Oh, okay. That's Miss Shawanda's class, my friend, one of my dear sweet friends. Okay, so let me explain how this works, and then I'll tell you a little bit about myself and how I came into this profession. I got the YouTube on here, so let me bring this up a little bit closer so that it can get a good snapshot of the board here. Okay, fantastic. And I may have to stop somewhere at some point to plug up. Okay, so again, my name is Miss Harper, so we're starting today. So what we're going to be learning just about every day is medical terminology. And the book you're going to need is by Chapner. It's by Chapner. And so let me write that down and until y'all get it. If you don't get it, it's okay. Everything will come from my lecture notes. And this is the 7th or the 8th edition of the book, Medical Terminology. Okay. And it has chapters 1 through 5 in the chapter book. So I'll give you a lot of lecture notes and then I'll explain to you why it's important to learn medical terminology, even for medical administration such as yourselves, okay? And we're gonna explain the whole health information management technology program and how you all fall in line with that. The health insurance we're going to learn from the book is by Fortney, okay? And it should be the 14th edition of Fortney, and it's handbook for the medical office. Okay, insurance handbook for the medical office. Okay, and it has chapters 1 through 18 in the book. So I'm going to do my very, very best to make sure that we get through all 18 chapters as much as possible. Okay, I know that seems like a lot and we're cramming. However, we're going to get through somewhere within the class time frame. We'll probably get through chapters 1 through 7, and then I will give y'all the rest of the packets on to 18 to finish at your leisure, and then we'll make some time to discuss it, you know, as time permits. Maybe we'll have a Thursday or something where everyone is pretty much comfortable with doing their electronic health records class or their CMO class, and we could take a one-day break, maybe every 2 weeks on a Thursday, and do maybe 4 or 5 chapters at a time from the insurance book. Now, you're probably wondering, well, why would you want to do that? I'm glad you asked. It's simply because I don't know where life is going to take you, you know, as far as you starting off. And I don't know, as far as like you starting off medical billing and coding, maybe you start off, do I have a pen? Yeah.
She told me to give you a number. She's gonna send you that.
Okay, I tell you what, hold on. I do better than that.
Hello, class.
How you doing?
That's what I'm talking about. I was wondering if they taking like the
So 4 hours, I be knocked out, I don't do nothing. Then you have to go to the bathroom, that's it. Go to the bathroom. What I need to do. Very stressed. Got a lot. Dealing with it like, First day is a long time. That's kind of more.
Well, my neighbor, and she does that.
And I would like her name because I have a name here, so I'll put it in the Thank you so And then, okay, when I didn't realize when she was going to, it's so upset. And I could just leave right here for my ex-husband. Just have to get away before it cuts around. And I don't never cuss my mom. I'm scared of that. I ain't never done that in my life. So instead of me reacting bad or saying something wrong, I just leave. Get going for my maybe 20 minutes, two half an hour, come back, and I sit down and try to talk to her about what's going on, and let her know I'm feeling and try to understand where she's coming from. I had my mother with me for 14 years. This is the first time in like 14 years she hasn't been in my house. She's a brother now.
That's the thing when they get the ones they're like they have my grandma when she and when she was younger, like everybody was around.
Okay, I'll talk with you in a minute.
Thank you, God bless you.
Yes, ma'am.
Okay, medical terminology, why is it important? It's important. Have y'all ever seen the show called The Good Doctor? Okay, if you haven't, I really would employ all of y'all to kind of peep at that show when you get a chance. I teach on Monday nights, I think, when it comes on. So anyway, but when I get a chance, I'll watch it. And but anyway, the way that doctor thinks about medicine and treating patients, the anatomy and physiology of the body, and how a certain part of the body and the name and the physiology of it, the function, it all plays a role in how he does his job as a physician to cure or fix the matter. So in my mind, as a coder, we have to think that way in order for us to know how to code something, okay, and how to consider it. So I want to say this first. Don't be hard on yourself trying to memorize everything. You're going to learn it over time. Okay. The most important thing is that you all are going to be familiar with the information. When you go out there and do the job is when the application begins. And then it becomes familiar. Oh, I know what tibia, fibia. I know what a humerus is. Oh, I know what, pancreas. I know what that is and how it functions. I know how, all that will all come together and make sense. Okay. So,
Sorry. The way I learned which one is the femur is by a joke.
Oh, really? What's the joke?
That when you have a cramp on your femur, is something bad is going to happen to you. And then he was walking and he stepped on some dog poop and slipped and he broke his femur.
Oh my God. Okay.
So that's how I remember that one.
He slipped and broke his femur.
Yeah.
Oh. Okay.
I know that hurt.
Yeah, that really hurts.
Well, it's a joke, but either way, I learned which one was it.
Oh, good. Well, yeah. Whatever catchy phrase it takes for you to remember or know it, that's perfect. I like that. Creative learning. Creative learning. Okay. That's right. That's right.
Oh,
So the medical terminology, you all right?
I said I had ones in my wallet. I ain't got no ones in my wallet.
Oh.
I got a 20 and a 10. And I
Oh,
can't use the vending machine. I must have
oh,
spent the ones yesterday.
I'm sorry.
Can't get-
Now, the insurance class, let me explain how that works. The insurance class, you all are going to learn how to file for insurance. How many of y'all have insurance like Obamacare? I guess they call it now Trump Care. How many of y'all have any kind of governmental insurance?
I do.
Okay, okay.
I haven't got mine.
You haven't gotten yours yet?
I got mine.
Okay,
I have
okay.
United Healthcare.
They don't want
okay,
to give me insurance no more.
Let me get this.
okay, okay. And
I
you,
have the women's Medicaid.
okay, 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 great. That's still insurance. That's still insurance. Very good. So what I'm saying to you guys is that you all are going to learn how it works, how the coverages work. You're going to learn the difference between governmental insurance and your commercial insurance. Your governmental insurance is like your Medicare, Medicaid, CHIPS, STARS. Okay, your commercial insurance, even though it may be under, I guess, Obamacare or Trump Care, but it's still housed through Blue Cross Blue Shield, United Health. All that is considered to be United Healthcare. Okay,
What about Cigna?
Cigna is commercial insurance.
I need to
Mhm.
learn how to get insurance. I need to learn how to get Medicare. I don't know how to sign the blue shield.
Okay,
I don't know none of that.
okay,
I've been struggling to get one.
okay.
I'm getting my insurance with Cigna, but
Okay, okay, good. So you get it through work? Oh, oh, okay, because you're a dependent.
No, because I'm still under 25.
So you're still a dependent, and we're gonna learn that,
Well,
yeah.
I'm already married, but they told her that I could still be on the insurance.
Oh, okay, well,
I
okay,
don't know. We rent, but it's the same house.
okay,
I know
well,
you said they're in the same house.
yeah,
So we
yeah.
have like everything separate from them.
Okay, okay, well, that's good. We'll talk about that part when we get to it, so you can learn how that really works.
Yes, because it sounds too good to be true.
Yeah, yeah, yeah,
I
but
was
just,
like, I thought when someone gets married, that's it.
well, typically, yes. Typically, yes. And I have to say typically, but we'll delve more into that a little later. But now, if you don't have insurance and you all are interested, I know someone that does the Obamacare or sign folks up for that. So tell me your name, sweetheart. Stephanie. I will get one of my dear friends that does that kind of recruiting and that kind of thing, and I'll have her to talk to you about it. I may have her come up here and do a little short talk about it and recruit for those who want it, for the next following year, because this is the season to recruit for the 2019 year. So you may want to think about having that. Okay. Um, then after we finish that, at some point after January 9, you all are going to learn electronic health records, okay? How many of y'all have ever been to a physician's office and they walk in with their beautiful laptop? Okay, great. So when they walk in with their beautiful laptop, they're recording information to you. It used to be like a manila folder where we would record information. So you're going to learn about mhm, mhm. Medical assistant. Those are medical assistant. No, you all are going to be medical administrative assistant. That's a whole different thing.
Maybe on the computer.
Mhm.
So it's medical.
Those are medical assistants, but if you all want to do that as part of your job or as a job doing that, then those are called scribes. So I'll explain to you the different job titles and everything like that. Those are called scribes. Scribes are ones that will sit on there and as the doctor is talking to the patient and checking on the patient and everything, that scribe or that medical assistant is typing up everything because they would know where everything needs to go in that electronic health record software.
So it's like the CNA, instead of doing paperwork, is a different person after the CNA goes in.
Well, now there's a difference between CNA and certified medical assistants. CNA, They're more like your nursing assistants, and they can qualifyingly do the job as a medical assistant. The only difference is that medical assistants have the best of both worlds. So they know how they learn how to do medical billing and coding, but they also know the clinical side, and they know more in depth of the clinical side than a CNA. A certified medical assistant, they know how to do back office work such as labs, blood tests, uh, different things. Know how to draw blood, things of that nature. They know how to do blood draws, phlebotomy work. They know how to do EKGs, things of that nature. As far as CNAs, they know how to do all of that, but they know how to properly place a person in bed, how to help them around their house or in the nursing facility, skilled nursing facility or assisted living facility, assist them in taking their medication, making sure that they get to and fro to their appointments. Okay, that's the difference. They're like junior nurses, and so are certified medical assistants. So certified nursing assistants are like junior nurses, but they don't learn as much as a medical assistant would. Does that make sense? Okay, so it depends on what you want to do. Now, you have some folks, they do a fantastic job starting off in as a certified nursing assistant. I was once one myself in high school, and I'll tell you a little bit about myself later. But it worked for me to where I got experience doing that at a hospital as a patient care tech, and then I moved over to working at a physician's office as a medical assistant. And then I was exposed to learn how to do medical billing and coding. And then from that point, I worked in the clinic on the campus of Prairie View A&M as a pharmacy tech, a medical assistant, and medical records technician.
Oh,
So it opened up doors. Okay, it opened up doors. So if you all still, would like to do CNA and comprise all that together in your work experience, you can do that. There's nothing wrong with that. I think it's a very well needed job because, I'm 49, so I'll be 50 come next April. So, the older I get, yeah, I'm going to need the help. I'm going to need somebody to make sure, Miss Hope, you all right? You need me to drive? Because I had to have someone for like 3 weeks after I had my hysterectomy. I had to hire a student to come and help me at my house. So those jobs are never to be underestimated, and I'm grateful for CNAs. I'm grateful for certified medical assistants that people just never know how much they're needed. I'm grateful to the house cleaning lady I have. She's been with me throughout my whole breast cancer journey and still to this day. Yes, ma'am.
I know you were saying that this is one part, there's another part
Mm-hmm.
to the what we're going for. Does that have something to do with the medical assistance?
No, ma'am. I'm glad you asked that question, and we'll talk some more about this. But the second half that you're speaking of that plays a role in this is called it's called coding. And that's something a little bit different and a little bit more in depth, but it has nothing to do with clinical work per se, as far as working hands-on clinically. No, all of this is strictly administrative work. So when you're doing this job, and then we'll discuss the different job titles that you all are going to be encountering to do. So I do that all the time with all my students. I don't want y'all walking out of the class and finishing the program and all you're mainstreaming your mind and looking for are jobs dealing with medical coding or medical billing. No, there's other jobs that you can qualifyingly do. And you have the background, you have the education, you have the knowledge now. So now you need to be properly introduced to knowing how to move around in the system of health information management, or what we say here at the colleges is health information technology. On a university level is health information management. So I'll explain the differences with all of that. And so that's a very good question. Does that help answer your question? Okay.
So I can, after this, I can go for a medical assistant.
Sure.
I think I was like, kind of getting it in one class, or I have to go?
Now, my best recommendation, if you do, go through the Coleman campus in the medical center, the Houston Community College Coleman campus, go there. And there's a guy, he's in my phone, I'll give you his phone number. They have a 9-month program for that. Typically, all your vocational schools, this is a vocational program considered under continuing education. They're typically 8 to 9 months. Even with this is typically 8 to 9 months, but we break it down in 4 months stamina. And there's a reason for that, and I'll explain that later. But if you go through the Coleman campus for Houston Community College for medical assisting, if you choose the 9-month program and you let them know that you completed 4 months of medical business office professional, perhaps they can use some of your MBOP classes to, how can I say, credit you on some of the MBOP classes you may need in their program. Does that make sense? So I know, because I've taught it before, where they may offer electronic health records. You already had electronic health records class. They'll probably give you credit for that. So talk to that advisor. Remind me to give you his name. I see it in my head. I just can't get the name correctly. And then they also have a 1-year program where it teaches you medical assisting, and then you tend to move forward in a magnet type setting a little faster with 1 more year to get your associates as a registered nurse. So they have 2 different types of medical assisting programs for that. So think about that. Again, remind me, I will give you his phone number. You can call him and ask when is their next information session for the 2019 year. You're welcome. You're welcome. Anyone else have questions? Very good questions. Yes, ma'am. Not at this. Oh, if you want to wear scrubs, you can. You can. But at this school, we don't require it. Any color if you want.
No, we can't do blue, they got blue already. Pink, pink.
Okay.
Purple?
Purple?
How about purple?
A dark purple? Yeah.
Okay. She said okay. And I think you can find the scrubs at Walmart. Now remember, the scrubs is not a requirement here. Your regular street clothes is sufficient. But I really admire y'all that y'all want to have a uniform look. So that's great. Go for it.
I was thinking we were gonna have to dress casual.
Yeah, you do.
Have to dress up.
Oh, okay. You can come if you want. Just make sure that you come decent. Not in your not in some after 5 attire. Right. We don't want to see.
Because when I was in high school, I was
Beyonce.
engineering classes. When I was in high school, I was in engineering classes, and when we had meetings or presentations, we would have to dress like with long sleeves, colored blouses, high heels, and just casual.
Okay.
So that's why we have to dress like that.
I had to be comfortable anyway. I wanted to go into medical administration.
Okay.
I wanted to be the person that has behind the desk when you come in for surgery. I want to
work on the surgery.
because I have a girlfriend that works at Cypress Medical Center. And she works behind the desk, and she sees patients when they come in and work, get them into the computer, let the doctors and the nurses know that they're there for their surgery or whatever procedure they have to do. She said, girl, once you get into it, she said, don't worry about it, you know me and I know you. I said, I need to get in here. But you see her at the desk all the time. And there's another desk around on the main entrance to the hospital. There's another administration office right there. Now that's the one I want to work in. This not where she's at, but the one in the main field, in the main hospital. And I know there's some nurses here that work there too. Sometimes they split the shifts and stuff.
Mm-hmm.
And I said, well, maybe I could get in over there.
Okay.
My doctor's like, I'll put a good word in for you. You know,
Okay.
my doctor's broke while I'm with that.
Okay.
Yeah,
Okay.
I got a cardiologist over there and I have a PCP over there. And it's, don't worry about getting a job. We will.
Amen. Amen. Okay. Well, you have the right personality for it. That's for sure.
I wanted to do medical diagnostics sonographer.
Mm-hmm.
And I go in on Thursdays. She does them after hours at between 4 and 6.
Mm-hmm.
And I go to Cypress Medical Center to the Dr. Jewel. And she performs sonography on patients. And she lets me watch and she tells you all, as long as the patient says okay,
Mm-hmm.
I'll go in and I'll watch the procedure being done. And she shows me which button is what,
Mm-hmm.
what it stands for, and how this works, and the images on the screen. So I got a little bit hands-on with that.
Okay. Okay.
I remember
Awesome.
one time when I was pregnant, the students had to go in with the doctor.
Oh wow. Yeah, I get all kind of experiences here. All kind of experiences.
Well, yeah, when he saw
Okay.
me.
So let's talk about the certified the computers in the medical office. So you'll be learning computers in the medical office by software called Medisoft. Medisoft is a popular software that they use in all of the doctor's offices. It's it's a very popular software. Your software in electronic health records is known as Medicine. Okay, Medicine is a popular software for the electronic health records. Okay, so let's talk about some of the job titles that you all will encounter once you finish the medical business office program. I'm going to bring this over a bit. Okay. Let's talk about job titles. Okay, so I'm going to circle this off, and remember, if you need to take a picture of it before I erase it, please feel free to do so. Okay, let me know, because I can start erasing stuff, but I usually ask before I start erasing. Okay, so one of the jobs and that you're going to learn in chapter 1, your packet that I've already given you for that, is you're going to learn how to be a medical coder. Okay, and we're going to Google this. Okay, at some point I'm going to give this to you all for homework to Google. What are the requirements?
They're not in service.
Okay, hold on. Medical biller. Okay.
I'm sorry, teacher, we're there for you.
Oh, it wasn't for me.
Sorry.
Oh, okay, okay. You were talking in your phone.
Crystal.
Oh, Crystal. Okay. Medical coder, medical biller, hospital scheduler. Okay. Next one is going to be called patient access rep. Okay. Now, patient access rep can vary in different levels. These folks can do the job of admissions clerk. They could do the job as far as insurance verification. They can do the job as far as customer service in a hospital setting. Okay. Now, you also, hola, mami, what's going on? Patient access rep, hospital scheduler. Then you have medical administrative assistant. Okay. Then you have electronic health records technician,
You said patient assessment?
patient
For number
access
4.
rep, patient
Patient
access rep. Now, the reason why I wrote that in parentheses is because patient access rep, there's different levels. So they may have what you call a patient access rep 1, patient access rep 2, patient access rep 3, patient access rep 4, and so on. These 1, 2, 3, and 4 represents the level of experience that they have. Okay, the expertise, how many years they've been doing this. That's what that means. In most of your hospital settings, if you're going to be working for Texas Children's Hospital or St. Luke's, Moore Herman, Methodist, they use those titles. So that's why I wanted to put that up there. So when you're looking, I can't find Miss Harper, medical biller, medical coder, or admissions clerk. Go under the title patient access rep. Okay. And you'll find that it's a uniform title. It makes it easier for human resources to categorize you as a patient access rep person, but how to categorize you as your job being administrative, not clinical. Okay. And it also helps them categorize on how to pay you and your pay status and your pay experience. It helps them know how to do that. All that is what I call HR savviness, where they have to structurally know how to categorize you within the hospital system. Okay.
Patient access with
Mhm.
one in the hospital.
So like, yes, the folks that sit at the desk, the folks that check you in, the folks that say, ma'am, how may I help you? Okay, ma'am, just sign in, take a seat, I'll call you the next.
We can get it all.
Oh, yeah. Oh, yeah. It's called patient access rep. Yeah, yeah. And these are different types of jobs. So those are patient access reps in the ER room, patient access rep in the radiology department. You said you wanted to work in a diagnostic area, somewhere like that. They have sonography or surgery, you said earlier, radiology. Those are called patient access reps.
Okay.
Those particular patient access reps are known as admission patient access reps. If you want to, you may have someone, they're going to interview you, they take all your information, and then they have you go and talk to the next person over the next counter, to another patient access rep. Okay, well, that's known as a patient access rep insurance verifier, where they're going to tell you, okay, ma'am, sir, your deductible is, your co-insurance is, your out-of-pocket is, and this is what you owe for your visit before you get into the hospital. Or your copay is, this is what you have to pay. Their specialty is just strictly that. They verify your insurance. They go online on the website to verify your insurance, and they're more than likely they will collect your money. Okay, those are different types of insurance access reps. Customer service access reps, those are the ones that they call your house. And thank you so much for being a patient at Memorial Herman. Thank you so much for being a patient at Methodist. I understand that you came January 19th, 2018, and we're still trying to collect that $500 amount that the insurance did not pay. How would you, yes. Yes, yes. How would you like to pay on that? Cash, credit, or check? You know, we can do electronic check, yes, or pay there. They will take payment plans. Okay, well, you owe $500. If we reduce it to $300, can you pay that off today? And then we can zero out your account. Those are called collections. Those are your patient access rep customer service people.
And they get paid more than a medical coder.
They do get paid more because they have to have more patience, but not only that, they have to collect. And the amount of money that they go by commission, exactly. So they go by commission on top of what they already get paid.
My sister is a medical coder.
Okay.
Now she just went to the customer service work. She says more money.
It is more money. Absolutely. It is more money. And does she gets her bonus checks every quarter or have half a quarter, like every 3 months, every month? But sometimes they,
No, she had a nice car.
yeah, of course,
House
of
fixed up
course.
and everything.
Oh, yeah, yeah.
And her daughter she does the billing for the insurance, like car insurance.
Mm-hmm.
She does the collections for them, so she gets paid a lot for that, and that's just car insurance.
Exactly. Now, for her, if you all are interested in crossing over to something like that, property and casualty or insurance, something like that, what you're learning in here will be considered a transferable skill.
So it gets to work with anything. It has to be like with insurance, just different type of insurance.
Okay, say that again.
So we have to take another class
Mhm.
or another or whatever to if we want to switch from the insurance. Like this is medical,
Mhm.
and we want to do like house collection or car collection. We take a different class for that.
No. Transferable skills is to say, I know how to collect money. I know how to talk to patients. Are you bilingual in a language?
Yes.
What language are you bilingual in? Spanish. So you know how to use your language. That's a pay increase right there. I know how to collect and talk to folks and explain to them this. So collections is collections. Whether you collect for medical side or for auto insurance side or for any other company that you work for. Collections are collections. The main focus of it is that when you finish in here, you will understand collections from a medical standpoint. But if you were to move over and do it for auto insurance or maybe for some other business out there, maybe for a bank, then the main premises that they're going to look at is that you know how to call, talk to folks, and collect money. If you were to come back and do it on the hospital side or a doctor side, you know how to collect from a medical side, except the only difference is you understand diagnosis codes and procedure codes.
Oh, okay. Because the other day I went to pay the insurance and they were doing like the classes for the tax prep, and they were saying all that.
Yeah.
And the class, well, I heard the class. I was outside and asked about it,
Mhm.
and they say that they were doing the classes to teach how to do it and all that.
Yeah. But it's no need for you to retake a whole nother class. No, that won't be necessary unless you're going to get deeper into it. Then that's something
So
different.
supposedly if I want to be a tax prep, that they will give me my certification.
Oh, now that's something totally different on that level. Being a tax preparer, that's something different.
Well,
Yeah.
there's many different things, but on the same level, like on the same class.
No, not for tax prep. Not to be a person that prepares people taxes. That's something
Because they were
altogether.
teaching about collections and all that too. So I don't know.
Okay, sweetie. Okay, I tell you what. Let's just take it one step at a time. One step at a time.
I'm sleeping.
No, it's okay. Just one step at a time, and then we'll talk. We'll come back and revisit that. Okay.
I'm trying to make my mind up. I'm falling asleep.
It's okay. It's okay. That's why I tape record like I do. So that way, in case you need to hear it again, you can hear it all you want to. By the way, let me write my YouTube channel up here so that you all can catch me on the tube. Let me write it in black. My YouTube channel is THCOD, and it has a red flower icon. Okay, it has a red flower icon. Like that, red flower icon, red flower. Okay, and then all you need to do is subscribe. So anytime that I'm doing a video, you're going to get updates on the video. Subscribe and hit the bell. So sometimes some of my lectures may sound repetitive, but sometimes I have a little added stuff in there that I don't have in another video. So I try to make them as unique as possible. Sometimes I can think of stuff off the top of my head and like, oh, I should have added that from the last video. Let me add that in this video. Okay. So, but you're asking very good questions, Lorena, right? Lorena. So, I want to work with you a little bit more independent on that when we get to the career services part in the resume. We'll talk more about that. Okay, so you can understand it a little bit better. Yes, ma'am.
Are you gonna help us make resumes?
Yes, ma'am. Yes, ma'am.
I don't know
And-
how to apply online.
Okay, we're gonna work on that too. I'm glad you said that. No, very good. I'm glad. I mean, please be vocal. That's one of the things I'm huge on with my students. Please be vocal. Please be vocal. If you don't know how to do something, this is the best time to ask. And particularly, I'm patient and I don't have a problem doing that. Okay, simply because you have a lot of folks who don't know how to apply online. They don't understand how to upload their resume. They don't understand that when you apply once, yes, for the same company, you don't have to start all over, but you may have to reapply, just add on a different position to apply to the last application you just did. So those are very, very good. And I might find some YouTube videos and have y'all to watch that. Is power, guys. It is supreme. I am huge on knowledge. Knowledge, and I love sharing it. Yes. Oh, okay. I thought you had a question. Love. Yeah, yeah, yeah. Because job I had in the insurance industry, not the last job. Last job I had that I paid for in the industry was two and 2 months after my husband and I married September 9, 2000. I was 18 years. So about 2 months we married. The had laid off everyone, and my group was to be laid off. So the next year, 2000, when they were having back their new and they go complete that application, but that was totally is to me because online, what is that? Yeah. Oh, okay. What is that? Go on the website. Okay. What is that? I mean, this is 2001. Online have been in existence. A, a lady since 2001. And so ever changing now. It's not what it used to be. Some of your small mom and pop employers where they still do pay application. But yeah, yeah, yes, you do tell you uh, go and you know how to do things. Right? That's all. With you. Mhm. You could get caught up. Yeah. Yeah, yes, you have. Do mhm. Yes, yes, yes. It Microsoft on there when I say office, make sure. Hold on. Microsoft Office Suite. Office Suite. Office consists of Microsoft Word, that's the blue one. Excel, that's the green one. Is the orange one. Publishing is purple one. Make sure access, I think it's dark green or blue, and then it has and like that. But the main port is Microsoft Word, Excel, and publishing. Desktop. So make sure it has on your computer. Mhm. You have to use an access key. If your computer came from okay. 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 You bring it, make sure you get it. Mhm. And then I will connect with the have a uh, technology that folks learn to do information technology ever they have one campus. Uh, touch here, professor over there, and so you take your over there. I've done my computers at another taught it, and they serve computers. And they did really with that. So you could take computer free learning experience. Them. You just have waiver, knowing that you let us work on it as a class project. Teach will make sure it's fixed well done. Yeah, teacher. Waiver, but the teacher make sure that won't get than what you brought. Mhm. Okay, that's why I refer you to that department, those things for their students. That way you teach well as a and they okay. Yeah, yeah. You are portable and I for my meeting with laptop and have a see it's like at that time when it was $50. I think now get probably now back then it was Chromebook is P meaning it should it should. I'm not very familiar with but it should. Mhm. Mhm. Yeah. And I feel really sure quote me on it. May have round of I department where there's a lot of laptops from professors that use um, like $200 and $300. I get email. I'll let you know. But if it's okay, I don't. I don't. I can. Yeah. Yeah. It's, I just don't do crowds. I don't do crowds.
You just feel great. Like you just waiting there and then they everybody runs for you. You just run.
Yeah. See, I get so I can identify with you. I'm one of those. I get high flesh.
Like one shot and you just like
Yeah. Yeah. Moody and, and you know I start down. I happen to my is never yeah.